Being a great BCBA isn't just about data sheets and functional analyses. It's about connection. In this episode, we explore the essential soft skills that elevate your practice from clinical to compassionate, because real impact happens when science meets humanity. Hi, I'm Shira.
And I'm Shayna. We're behavior analysts who create weekly content about how to teach children with autism so that they make real progress. And we create shareable resources to make your job just a little easier. Today's topic is all about soft skills for BCBAs. And if you want more videos like this, make sure to subscribe and hit the notification bell to stay updated on new video releases.
So when I thought of compassionate care, I thought of kind of like bedside manner for a doctor. And I have a doctor, and when I go to the doctor, I feel like this is the most important thing in the world because like I'm struggling with it and I obviously want to be here, but I didn't think it was a big deal. And my doctor has a way of like sounding like a little bit condescending or like patronizing when she's like explaining it to me. And she uses this phrase that's something like, does that make sense? Does that make sense? Do you understand? And I just find it so like almost rude because like it doesn't feel compassionate to me. Like here I am trying to like, ask for help, which is not easy, and I would love a little bit of compassion. And so like what does that look like similar to us as BCBAs?
So, what does soft skills as a BCBA look like? There's things in the textbook we talk about, we pass the big exam and we have all this huge terminology, but no one says, oh, well, you actually have to talk to a parent really nicely and be fully present. That's not in the textbook. Well, huh? What? But really, like, put down your computer when you're meeting a client. If you're going there, have that 5 minute chit chat at the door. I don't love small talk, that 5 minute chit chat, but you know what? If that's what's going to help the parent feel comfortable with me, whether they're dropping off a kid at a clinic or whether I'm walking into their home, if that 5 minute chit chat is going to make them feel more comfortable with me, then great. And you know what? That 5 minute chit chat may actually help me too because I can learn a little bit more about their family values, or that they're going on vacation next month, and their student doesn't like to wear seatbelts in the car, or their child, whatever. So those little things that I think aren't relevant do go a long way.
And the soft skills are so important. Like we can't emphasize it enough, which is why I love this topic because we do talk a lot about, the technical skills of being a BCBA, and that is really important. But something I often say is that technical skills can be learned, but the soft skills are going to be the thing that, really make the difference. And if you're not working on that, you're not, your technical skills will only get you so far. And so it's so important to practice the things that we're not really taught on well, now they are becoming part of the task list, but a lot of us were so focused on the technical side, and that now is the time to really focus on the soft side and the compassionate side. And like Shana said, one of the most important things is that interaction piece. And I often say, like, don't be a computer BCBA, even though so many of us rely on our computer and so much of our information is there, and sometimes our data collection is there also. Put it away. Like, it shouldn't be the first thing that parents see when they see you, and it shouldn't be the thing that you're talking to them in between a computer screen. Whatever you need to do, I usually, for meetings with parents, even though like I rely on my computer, I'll bring a piece of paper and a notebook, and it's a little bit of an extra step. But often it's just that computer gets in the way of building connection.
Sometimes I will bring my computer with me, but I'll have it closed during the conversation. If there's something really important, I'll actually say, just a second, I'm going to open my computer because I really want to record this or write this down. Again, there's going to be a AI at some point in time that is going to be HIPAA compliant that we can just pull out and that's going to do our work for us. So those, that productivity will still be there while we're having those conversations, but making sure that we aren't sacrificing that compassion for the productivity. And I know, because I think like this, like, oh, if you just don't stop me at the door on my way out the door, I can just do my notes and I can like, oh, have time and I can still get home on time. So I hear you with that, but sometimes it does go a bit further just to be able to have that conversation. I used to study, or I used to work with Bridget Taylor, and it's interesting because Bridget Taylor and Linda LeBlanc put in, they wrote an article about compassionate care, and I love that article. But long before Bridget wrote that article, about 20 years ago, I was talking to her because I was going to a conference, and I said, like, do you stick around for the Q&A part afterwards? I personally don't love sticking around for the Q&A because I need to get to the next event or what have you. And sometimes the Q&A is, parents asking about, oh, my child does this or my child does this. And it's like, I know that answer. Like, let me just get on with it. And Bridget said, always stick around for the Q&A. She said, it's not about listening to the questions and hearing the response. She said, look at the way the speaker is responding to the questions. And I had to think about that for a minute, but think about it. Look at the way the speaker is responding to the questions. And I look at Bridget when she is in presentations and she's responding to Q&As. Now everybody's going to go to one of her presentations and look at her now. But as somebody's asking the question, do you know what Bridget's doing? She's nodding. She's nodding like, yep, I'm hearing you. I'm hearing you. And you're like, whoa, like, such a subtle thing, but you're like, oh, that's amazing because it's really showing that she's attentive as she is nodding to me right now.
I'm learning. I'm learning.
But also, the way her stance is, her arms are open, she doesn't have her arms crossed. She's not looking at papers as someone else is asking questions. And then when she gives the response, a lot of the time she's smiling, like, I'm smiling, I hear you, I'm compassionate, I've got this. And then she gives the response in just such a great way. But it's the body language. So when you are training, if you're being supervised right now and you're not quite a BCBA or you're not, you're with somebody else or a coworker talking to parents or talking to other individuals, check out that body language and take a look. Is it showing empathy? Is it showing compassion?
And that really, you're talking about active listening, which is more than just hearing what someone is saying, but you're actually listening to what they're saying. And you have to really listen to be able to build trust. And that is definitely a mistake that I made as a new BCBA was, the parents could tell me what it is that they wanted or what some of their goals were. And sometimes I would just think, yeah, but I know better. And so I'm not like, I can hear you and like, that's great, but I'm just going to do it my way. And I made those mistakes, and it's not effective, but it's also not ethical or compassionate. And so I think you really have to put yourself aside sometimes. And empathy really means putting yourself in someone else's shoes. And that means that you can see the world from their perspective and you can understand why that might be important to them. And then it doesn't have to be the same thing that's important to you.
It could be so frustrating sometimes as a BCBA because you can see the path. You can say, I've done this assessment. Like I can see if you just implement X, Y, and Z or X, Y, and Z, and I'm Canadian when I say Z, when you just implement these things, you can get here. But the parent then says, that here isn't my goal. And you think, well, why isn't it your goal? It should be your goal. No, it shouldn't be. You're pushing your agenda on them. Look at your implicit biases and go, okay, let's look at what the parents' goals are. And, it's really cool because Shira in her practice, she actually rates level of importance. So, they determine goals on an assessment and then they give it to the parents and they say, well, rate your level of what do you call it?
Priority, like how important is this to you on a scale of 1 to 10 in the different domains of life? And they're able to give us a rating scale. And then that guides us in being like, well, even though I think social skills is really important for this learner, to the family, it's not. So I'm not going to teach it or focus on it as much.
So asking the parents what their goals are is one thing, but then implementing what their goals are and showing that you're really listening is so important. I was a ski instructor when I was younger, and I remember learning like, okay, here's the different steps, here's the progression of skiing. You start here, and then you go here, and you go here. And then when I first started teaching, the person I was with, and they said, to the group, well, what are your goals? And people had different goals. I want to be able to ski with my kid. I want to be able to keep up with this person, blah, 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 blah. And they said, great, we'll get you there. I'm like, no, but that's not the steps. No, you're supposed to do this first. And I just thought it was so cool because it's no, ask them what their goals are. If you're teaching kids, they're like, I want to huck a jump. Like, I just want to jump off this thing and look really cool in front of my kids. If you're talking to a parent, the parent is like, I just don't want to hurt myself, right? Two different ways of instructing. So, looking at that and applying that, in our field, ask the parents what their goals are. If the learners can talk, ask them what their goals are too.
Because more than we work with behavior, which I know that's our comfort, we work with people. And we can't just focus on the behavior without focusing on the person. And that means that we're looking at private events and culture and the things that are really make a whole person. That's not just the discrete behaviors that we're looking at. There's so many different ways to say the same thing, and thinking about like in the way that I'm saying it, is it going to build collaboration or will it build resistance? We want to have conversations in ways that aren't going to make people feel defensive, or in ways that are just, getting my agenda out there without listening to anyone else's agenda. This works with parents, but it's also the same for other professionals that we might have to work with, and also with the kids that we work with. We need, I know, 100% buy-in. For us to do well at our job, we rely on other people, their behavior, their follow through, their implementation. And so much of our effectiveness is going to be how we reach people.
I also think about our jargon that we use, right? So, hey, I just passed the exam and I read this massive textbook. You should see the size of the textbook now. Um, I want to use all that terminology. And with parents, that goes right over their heads. Like, unless they want the technical terms, try and use analogies, try and use plain language when you're talking to them. And what's the word that you don't love, or what does your doctor say?
Oh, does that make
Does that
sense?
make sense, Shira? Does that make sense? You could say, "Hey, are you following me? Does that make sense? Do you have any questions?" But not in a condescending way, right? So making sure that that is all there as well.
Also, even when I'm talking to people who probably do understand the jargon, it's just I don't use it. It's just a good habit to get into. Even when I'm talking to other professionals, to talk in plain language, because even if they understand it, it shows like compassionate communication. It's not, there's a way to talk professionally without it seeming, condescending or yucky.
Yeah, for sure. And just really like, when the more compassion you have, it goes a long way with caregivers, but also with team members as well.
And I think, like I said earlier, so much of what we do is going to depend on other people. So we have to be flexible, because we can't always change everyone's behavior. We have to be flexible to be putting plans in place that are taking that into consideration. Being flexible means that we are open to feedback, that we may write a different plan if it's this staff implementing it versus if it's this staff implementing it. And that's okay. And we're open to that, because we can, understand that people are different. People have different strengths and different weaknesses, and we can be flexible. So I think the important part is that um, compassionate practice really does start with us. Um, we have other videos on compassionately targeting specifically challenging behavior. We talked about that in episode 129, and how we can change how we approach challenging behavior from a more compassionate perspective. So definitely go check that out. But we also have to remember that there's a level of awareness for ourselves. We have to know, like, am I regulated enough? Can I have this conversation, this difficult conversation with a staff? What is my tone? How am I coming off? Am I prepared for this? And I think having that ability to self-reflect can help us show up in a way that's compassionate, but also help us avoid burnout. We carry so many problems. We carry so many, stress, so much of what other people are struggling with and comes loaded onto us. And so we have to also be compassionate to ourselves in dealing with all of that, but knowing that we can only reflect compassion from a place of calm and regulation. So if someone's, really upset and really worked up, or we're dealing with a challenging behavior, do we have the tools to show up compassionately in that moment? And that is a really big question.
Yeah, I think that's really about regular self-reflection and asking yourself all of these things. Somebody named Anika Hoiberg, who developed the Modus, has a free form called the Kindness Method, and we can post that in this blog as well. But that is really just looking at that, going, okay, here's some soft skills. Do I have this? Do I have this? Do I have this? It's a nice checklist to look at.
And I think just remembering that always putting the dignity of our clients and our families first means that we're seeing them as people and not just data points. Like, compassion isn't in contradiction with science. It really enhances science. So we shouldn't get caught in the data, in the minute behaviors, but we really have to think big picture and look at everyone that we're dealing with as a whole person.
Yeah, like I mentioned before, Bridget Taylor, Linda LeBlanc, and Nozick have an article. It's called Compassionate Care and Behavior Analytic Treatment, and it's really all about, that outcomes can be enhanced by attending to relationships with caregivers. So check out that article too. I'll post it in the link.
For more information on BCBA soft skills, click the link on or around this video or in the description to join our CEU event, Compassionate Competence. We also encourage you to subscribe to the channel so you don't miss any future videos and leave a like and comment below if you have further questions.